This case is about a 45-year-old male that has been married for 15 years and has 2 children. Although he has a history of major depressive disorder, the scenario tells us that his condition is well controlled with Celexa 20 milligrams daily. The patient comes in today distraught because he has learned that the wife has been having an affair for the past 2 years and has decided to take the children with the man she has been having an affair with. The patient states he feels stupid because he has no idea that she was cheating on him. In addition, he feels what is a point in trying to better himself if this is going to be the outcome. The patient admits to taking time off of work due to these new developments. Although work has been understanding, it is only a matter of time before his job is in jeopardy. When questioned about suicide, the patient admits to a suicidal ideation and using alcohol as a coping mechanism. In addition to the ideation, the patient has a suicide plan of killing himself with a gun. When asked about positive factors of suicide, the patient states his kids, but he does not seem realistic about the possibility of seeing them anytime soon. Based on the scenario, the patient needs to be placed on a legal hold and taken to the nearest psychiatric facility or an emergency room immediately. According to the Centers for Disease Control, these are the top reasons for suicide that pertain to the patient. History of depression and other mental illnesses. The patient has a diagnosis of major depressive disorder. Job financial loss. The patient is in danger of losing his job to the loss of attendance. Substance use. The patient states he's drinking a 6-pack of beer every night as a coping mechanism since his wife left him. Sense of hopelessness. The patient states that the only hopes seeing his kids is doubtful since a wife is probably not going to let him see them. In addition, the patient admits to suicide ideation with a lethal plan. As a provider, the only safe and prudent thing to do is to place this patient on a legal hold and call 911 to have an ambulance transport the patient to the nearest emergency room. The next scenario is about a 19-year-old married female that has a 2-month-old baby. This is her 4th visit with the provider. Her husband is accompanying her today. She presents today dressed more provocatively than on previous visits. Her makeup is heavier than usual as well. The baby is in a carrier, peaceful and sleeping. She immediately starts discussing a video series on aliens that she has been watching. Her speech is rapid, loud, and bounces from topic to topic. She makes several loose associations between the video series and her baby. From her rambling, it sounds as if she believes that an alien and she needs to take it to the desert and leave it on the mountain for the aliens to come and retrieve it. She reports making plans to go camping with the baby and her husband this weekend. You question her about suicidal and homicidal ideations. She denies both. The husband states she's been acting different for a couple of weeks and has never behaved like this before. She is scared to leave her alone with the baby. She interjects that she knows the secret to world peace and giving their baby back to the aliens will accomplish it. What should the provider do? It is clear that the patient is experiencing some sort of psychosis. It is also clear that if the provider does not intervene, the 2-month-old child will suffer a tragic event, since the patient is already planning to go camping in the desert and leave the babies for the aliens to find. What is not clear is if this psychosis is new to the patient or if she has some sort of history of schizophrenia or bipolar disorder with psychotic episodes. The patient may be under the influence of some psychoactive drug, such as methamphetamines or LSD. Regardless if the patient experiences an acute or known schizophrenic episode, the safety of the 2-year-old and the husband is paramount. The provider should take the following steps. Perform a drug screen on the wife to rule out psychosis due to an illicit substance. Place the patient on the psychiatric hold and have EMS transport her to the nearest emergency room. Educate the husband on the need for the psychiatric hold both for the safety of the child and himself. And lastly, work with social services in case that the husband may need someone to watch a 2-year-old while the patient is on the psychiatric facility. Thank you very much.